Good morning. We are going to give everyone a couple of minutes to log in.
Good morning, everyone. Are you able to hear me?
Good morning.
Good morning. Yes. Good
Good
morning.
morning.
Good
Great,
morning.
great. Good morning. Well, good morning, everyone. I'm happy to be with you on this pre-Friday. Weather's better than it has been. Hopefully it'll continue to hold and we won't get more snow. But we're really glad to be here this morning. I'm going to be brief. We've got a few presenters here, and I don't want to take up a lot of time, but there's a couple of things that I just want to update for individuals, and a couple of reminders as well. First, if we go ahead to to my slide for me, Mara. So just a couple of things on the federal side, our EHS, and EHSCCP, we know that we're getting monitored for a FA1 monitoring event. We're going to continue to refresh. This is a refresh because we've done this before. I know the teams are working with you all, making sure that everything is in good order. I just want everyone to continue to work together as we move forward on this process. A reminder, as I mentioned before, um, they in they can do one or two things. They can give us a 45-day notice, letting us know what date they're going to come and be here with the city of Chicago, or they can determine and decide to do an unannounced. As a result of that, that's why we're doing the refresh, making sure everybody is reminded of all the different things that you need to have ready and be prepared. The difference in this FA1 monitoring, and I went over it with those of you that are federal recipients on these two grants, they're doing something different this time. And what they're doing differently, for example, is they're doing on-site visits on an FA1. Normally that would happen in an FA2, but this time it will include on-site classroom observations, or they call them events where they're coming into the classroom. They will be interviewing and have the ability to interview teachers and staff at the sites at that time, looking to make sure that they can see lesson plans, they can see curriculum, they can see all of the things that are supposed to be done and have available within classrooms. And because they're going to be in buildings, what they're able to do is also walk through and look for health and safety. We talked about it when we met, so it's a reminder again, make sure that you're refreshing your classrooms, that you're looking at your outdoor spaces and making sure that they're ready for child play, meaning that they're safe and safe from harm. So making sure that you go through your playgrounds, making sure that there are no issues with either the structure or the level of whatever it is at the bottom that protects children when they fall. Most of you don't have wood chips anymore. You have rubber. Whatever you have, make sure that it is intact. Also, making sure that if you have a playground structure that has a fence around it, make sure the right fence is there. And please make sure there are locks on your fence. Because again, that was one of the things that came up in our FA2 before, where they noted that there were some fences that didn't have locks on them, which could also mean children could get out. The last thing about playgrounds and structures in your classrooms, just want to remind you about, is looking and making sure that there is nothing going on in your classrooms where a child could be harmed or encased, meaning that there's a small space that children can crawl into. There's a fence that they can crawl under. You've got to check and make sure all of those things are done. I know our health and safety teams are out there looking and helping you, but I just need everybody to pay attention to your indoor and outdoor spaces as we're moving forward and refreshing. The next one, Head Start Early, Head Start CCP. We do have two change in scopes that are still in process. They went in September with our grant applications. We've been notified that OHS is working to complete their work on both of these. And so we're hoping to get something back really soon. As soon as we do, for Head Start Early Head Start, that is a community shift. We'll let you know that community area has been approved and we can begin work on that. And for EHSCCP, we've already worked with you on your numbers to make sure that as you were enrolling within the number that we were anticipating in our change in scope. But what both of these mean for us, and we are still under an under enrollment mandate. We have not made our 97% on our grants. And so we know for both of these, our change in scopes will be a help agent on both sides. And that's why I'm really working and trying to keep with OHS, working steadily to get these approved, because the children that would be that would be enrolled on these grants will actually stabilize the enrollment in those grants. And so be ready the moment that we say that it's done and it's okay. We need you to be able to immediately start affecting your enrollment of your children, especially on Head Start, Early Head Start. We'll be working with you as soon as we know, but just want to make sure that you start thinking about who's in those classrooms, what children are eligible, so we can document that immediately so that that will count for enrollment the moment that they let us know. On the state side, Early Childhood Block Grant update. We've received the draft list of agencies that will remain with DFSS under the new funding structure. We've talked about it. We know you've been notified by your other federal recipients, and we've had multiple conversations. But what I'm just updating you on is we have received this week the draft list for agencies for DFSS, meaning looking at exactly who's staying with DFSS effective July 1. Looking at, again, it gives us an opportunity to see who's moving off. Because those of you that are leaving us, and it's a typo there, I was trying to fix this morning, but we're going to continue to work with you because we do have a closeout process that we have to complete with your organizations. And so our operations team, our health and safety team, data teams, and others, they're going to be working and engaging you throughout this process for closeout. Closeout meaning that we're going to be closing our books on our work with you, making sure that our files are complete, making sure that we have done all of what we need to do and documented everything that we need to do so that we can close those files and say, this is the last time that we're monitoring these. This is what we found. This is the last document that we have in our data system from you for your enrollment, et cetera, et cetera. But we will need to close all of those things out as we move through this process. For those of you who've gone through a closeout with us on the federal side, we'll be doing something very similar, making sure that we also know that the enrollment is intact, meaning that as you move off from us, if we've got 17 kids enrolled in a classroom, we're handing over 17 kids in that classroom under this new structure. So we just want to make sure that we've done all of our due diligence to make sure that our records are clean as we close out for June 30th, for those of you that are leaving our funding and then moving over to your federal recipients funding. I'm going to stop and see if you have any questions for me, and then I'm going to turn it over if not. So I'll hesitate for a moment. I'll look to see if anybody's unmuting and if any hands go up. I see two hands. Dorothy, I think you beat Catherine. So Dorothy, I'll take you first.
Yes, I just I heard you regarding those who are staying and those who may not be. Will we be receiving some correspondence on that? Or
Yes, you
did we?
will. No, as soon as we are confirmed, we are going to send out something to you, letting you know this is what we understand and where you
Okay.
will be. And I'll be doing that with those that are staying with me, but I'll be doing that also with those that are leaving to make sure that we're very clear in this process.
Okay, will that be in the next week or so?
I'm
Or
hoping
you're
that
not
that will be
sure?
in the next week or so. I got the list. There were still a couple of questions, so I can't move on it just yet. So as soon as
Okay.
everything's clarified, then we'll be able to do that.
Thank you.
Oh, you're welcome. Catherine?
Hi, similar question. I just wanted to make sure my understanding, it's the agencies that just have like federal dollars. Like if we just have ECBG,
You're remaining.
yeah, that's what I thought. Okay, cool.
No,
Just confirming. Thank you so
yeah.
much.
No, you're staying with us. Thank you. Jeanette, I guess you had the same question. You brought your hand down. Go ahead, Jeanette. You're muted if you're talking. I see your question in the chat. For Head Start and Early Head Start, will there be an opportunity for additional slots with DFSS? We will be doing an RFP in 27, and that's the time in which everything will be restructured, or based on the outcome of the RFP, who will have what under us. But that's when we have agreed with this new structure to hold steady for one more year. So the RFP that goes out in 27 will be the opportunity for more slots. And before we do that, we're also going to be doing competitive grant sometime between now and June 30th as well, which will level set the grants here in Chicago. And so more to come on both of those. Anyone else? Dorothy?
Yeah, I know that's the PI and PFA for 2027, correct?
What we're looking at is both for 2027. The RFP for 27 will be 27. What we've agreed to is to hold steady for 25, 26. So somewhere between now and July 1 of 27 to have put out that RFP and formalized exactly where those slots are for us, for both federal and for state, but definitely for PFA PI.
Okay, for federal and for state, I guess I was more federal, the EHS-CCP and EHS expansion. Is that up for recompetition this year? Correct?
The EHS-CCP is, the expansion is not.
Any updates on CCP? No?
The change in scope on both, on the Head Start, Early Head Start, and the Early Head Start Child Care Partnership. We're still waiting on the confirmation from both of those. We just got notified this week that they are now working on them. They've been backed up, so they hadn't gotten to them. So we should be knowing something soon.
Okay, thank you.
The question in the chat is the competitive grant for federal and for state. The competitive grant, or the competitive grant for federal, that's the federal competitive grant that we're speaking when we say competitive. It's only federal for competitive. What I am saying is that we are planning to do an RFP, which will be competitive, but not at the same level for OHS. But we will be doing that for that. And what we've agreed to is to do that for year start July 1, 27. I don't see any other hands raised, and I don't see any other questions in the chat. So I'm going to go ahead because we do have quite a few presentations here. Toy, I think you're next up.
Thank you, Sir Rachel. Good morning, everyone. My name is Toykesia Tidwell. I'm the Grant Fiscal Monitoring Manager here with Chicago Public Schools Office of Early Childhood. Today, we wanted to go over some of the fiscal monitoring that we've been doing at agencies for the PI and PFA grant. And our monitoring work is intended to support the work that DFSS is leading in providing agencies with fiscal guidance and oversight. So during the presentation, I'll walk through some of the patterns and things that we've been seeing through our monitoring work that kicked off last fall, and highlight some of the strong or best practices that we've seen in the field as well. So the purpose of this update is to connect a few things. First, to share some consistent themes that we've been seeing from the monitoring across multiple agencies for the PI and PFA programs, to highlight some strong practices, as I've said, that are already working well at agencies and helping them to stay audit ready, and then to reinforce the fiscal guidance that DFSS shares with the agencies so that the monitoring becomes aligned. So I've identified 3 key monitoring themes from our monitoring work. One is payroll documentation, the second cost allocation, and the third budget alignment. So we've seen some isolated issues at agencies and their core fiscal control areas that tend to come up consistently across our monitoring work. So I'll briefly walk through each of these in a little bit more detail. So this first one here on the next slide is payroll documentation and salary support. So what we've been seeing is instances where the time and effort documentation is missing or incomplete, or where the payroll records don't clearly align with what's being charged to the grant. And in some cases, the salary charges can't be clearly tied back to the program responsibilities. And because personnel costs, especially program personnel costs, are the largest portion of the budgets, this is one of the key monitoring areas that we tend to focus on. So I can't iterate it enough to make sure that everything is lined up and that we're supporting the payroll with documentation like our time and effort or our PARs. The next one is cost allocation. So this comes up when staff or costs support multiple programs, but there isn't a documented methodology explaining how the costs are being distributed. And then we're also seeing inconsistencies in how the costs are shared across these funding sources. So perhaps there is a documented cost allocation plan, but it's not being consistently applied. So if you have more than one funding source, Say if you have a classroom that supports Head Start and PFA, then costs for that should be, just like your teachers are split funded, then the cost should also be split funded or allocated. So having a clear and consistent allocation method is really important and helps to support the charges when you have a monitoring engagement. The last one is budget alignment. So this would include situations where personnel charges exceed what was approved in the budget or staffing levels go beyond what was planned. And then in some instances, expenses are coded to the wrong cost category or budget category. So monitoring in this area is really about making sure that actual spending stays aligned with the approved budget and program requirements. So we want to make sure that we're lining up with that. So we'll go over to some strong practices because it's not all bad. So we're seeing a lot of good things that are happening at the agencies, like internal fiscal reviews before invoices are submitted. That's very important. Having the documentation organized, especially when we come on site. I know we've been checking a lot of student files and personnel files, so we appreciate you all having that organized documentation when we come on site. And then having those clear procedures and strong coordination between the program and the finance team, so everyone is communicating and on the same page. So these really make the difference, and they tend to reduce findings and make monitoring go smoother overall. So the key takeaways from this very brief presentation are fairly straightforward. Maintain a clear payroll documentation. Please do your PARs. Document how shared costs are allocated and regularly monitor spending against the approved budget. So agencies that are doing these things consistently tend to have the strongest outcomes that we've seen during our monitoring. And this is, again, all intended to align with what DFSS is providing through their guidance to the agencies and the work that they're already doing. So that was pretty quick. Does anyone have any questions, comments, concerns? Okay, I'll hand it back over to, oh, I see it.
Sorry. I
Yeah.
did have a quick question.
Catherine has a
Hopefully it's
question.
quick. So because we've had like a couple expenses that weren't like that got rejected, and so just if we have questions about like how like the spending against the approved budget, if this is like could be interpreted right, it's like the same category but it's a slightly different thing, like getting pre-approval for that, or like just more clarification on that process.
Now, when an expenditure gets rejected, so that's something that happens on the
Yeah.
front end. That's before monitoring.
Right.
So all the DFSS.
Trying to avoid that in the first place, I guess. So like
Yeah.
trying to like if we're like, oh, this might be different from what we put in our approved budget, like it should still count, but like it's different from, would we just talk to Angel ahead of time before submitting that? That'd be better
Yes, you
under
should.
this.
That's the reason why we ask for your budget narratives. That's the reason why we ask in your budget narrative certain things be explained, like subscriptions or conferences, things like that. So this year we've been on it about making sure people's budget narratives match what they actually say in the budget by line item.
Right. And I do get that. It's just what you decide at the beginning of the year might change, right? Like you might have people like it's to the best extent, like that's the plan that you want to have, but like things change. There might not be able to go to like one conference, but they can go to a different conference, you
And
know.
that's the beautiful thing. When it changes for you, you must then
Mhm.
come back to me and say, this is what the plan is. Can this be
Mhm.
approved? So when you do your budget revision, or it could be you don't actually need to do a budget revision because the dollar amount is still in the same line. You would
Yeah.
just email me your budget narrative explaining what the difference was. This is what we plan to do. This is what we want to do now.
Okay, so just update the budget narrative.
Yes.
Cool. Okay. Thank you.
Will, go ahead.
Yeah, when you say document allocation methods. What does that look like to you? Is it some sort of fiscal document or, yeah, what are you looking for there?
So organizations would have a cost allocation plan. So that is a written plan that you will have on file, and that helps you determine how you're going to share costs across multiple funding sources. So that will be a written plan that pretty much outlines your methodology for how you're going to charge, say, rent expense across PI, PFA, Head Start, Early Head Start, and whatever other funding sources that you might have. But you would have that written plan in place, say, it's based on enrollment or based on the number of classrooms at the site or something to that nature.
Okay. And so like square footage would be an example of a kind of a cost basis for allocation?
That could be used as a cost basis. As long as you guys have that cost allocation plan in place, we can work with that. When there's no cost allocation plan and then 1 month is 20%, the next month is 100, and then 50%, 15%, it's all over the place, then that's where we run into issues.
Mm-hmm. Are the allocation plans ever kind of questioned in your
From
in your
DFSS
monitoring?
side, from DFSS side, yes. Once we receive your allocation with your budget, if I have a question, I then reach out to the agency and ask the question. Because for most
Mhm,
agencies, how you charge your salary is different than how you charge the cost for supplies.
mhm.
And so if you have a question about your cost allocation, feel free to reach out to me.
Mhm. And one more question. So if you budget for a certain position or teacher and you go over that budget for that teacher and your actual expenses, like what
You, sh-
happens
you should
at
have done
that
a budget
point?
revision. You should have done a budget revision before you do that,
Mhm,
because if you
mhm.
actually go over, CPS has the right to ask for those funds back.
Okay. So they could ask for the money back. Are they asking for the money back or, because I mean, we still could do budget revisions up until I think a certain date.
You
So
should probably go ahead and do that budget revision for me.
Mhm. I'm not saying
when
I
we,
need, I'm just kind of getting a feel for what's happening. I don't think I need to right now, but I'm just saying
yeah,
if you have to go over a budget for a particular line person, like you should do a budget revision because if you go over that, that's a problem, is what
well,
you're saying.
yeah, because your budget that you've already created, you created it with that amount in there. If you need to make an adjustment, you've got to adjust your budget to reflect it, so
Mhm,
that everything aligns.
mhm. So if you budget, let's say for a teacher for let's say 10,000 for the year and you go 15,000, is that considered like an issue?
Well, you needed to do the question is two questions. Number one could be the question why. Number two is where are you getting the other 5,000 to compensate for that? That's where you got to do the budget alignment and figure out how you're doing that. You're not getting additional dollars. The question is how are you paying for that? And you need to show that within your budget revision that you would be submitting. So that when
Mhm,
the auditors and everyone's looking at it on the other side, they're looking at your budget for what you said you were using. If you go over that, they're trying to see where the adjustment is.
mhm. And
Angel,
so if
go
you're
ahead.
over,
Go ahead.
Please also remember that if you go over and you need to change something, your cost allocation needs to change as well, because your cost allocation set the tone for how much you needed for that salary.
mhm. And so let's say I go over budget on a particular person, let's say teacher one, and then teacher two, I go under. Well, I took dollars from teacher one and went and gave it to teacher two in that example. Would that be sufficient proof that, we were within budget? We just kind of reallocated within the actual year, program year.
So I'm saying from an audit standpoint, that's a red flag, because your cost allocation said I'm only gonna charge 20% of anybody's salary to this grant, regardless of whether they took sick days, you decided not to pay them, whatever. Your cost allocation says one thing. When CPS comes in to audit and they see that your cost allocation is this and you go over or you go under, they have the right to ask the question.
Mhm. I don't want to get caught where I got to reimburse CPS because, I paid for a teacher that I didn't put enough money in the budget for.
So in most cases, let me say this, you're not CPS isn't asking you for money back. It's not going to do that because you're working through the city system. I will tell you, if you misrepresent, and I'm just going to use that word because I can't think of another one, Will, in your budget, you do something different in the audit because they're auditing and they audit agencies, then they come to you trying to figure out what you were doing and why you didn't do what Angel's talking about. Because what you say you're going to do when you do that budget, the expectation is that's how you're going to utilize your dollars when you're putting something into the iSupplier system. When you're putting invoices in there, they should align to what you put in your budget, and that's what they're looking at. So when you decide you're making changes, then you need to actually go in and do a budget revision so that that narrative, that budget, and those invoices all align, so nothing is being red flagged, as Angel said, right? What we do, for example, if you're under expending your budget, then we work with CPS, because at that under expense, those dollars go back to CPS's, if to PI, and PI, for example, if we do it early enough, and they can reallocate those dollars, right? But if we wait until the end of the year, and that's why Angel has really been working with all of you to do budget revisions, then look in your house and figure out how you need to utilize your dollars. But you got to move them in those lines to be able to actually use them in those lines. Because if you haven't made that adjustment, you shouldn't be just invoicing saying, this is how I want to use the money. You have to document how you're going to use your money on all of the line items that's in your budget. And so that's why we come to you and say, do a budget revision. Make sure you move what you need. If you have a position that's been vacant and there's a personnel cost on your budget that you were anticipating using that you didn't use in your budget revision, you can make some determinations about moving those dollars on another budget line. We want you to spend all your money. We don't want to turn any money back, and we don't want anything going back to the state, and we're able to work with you on that. But at the last minute, that's when we get in trouble. And what Sharon just put into the chat is budget revisions are due by 5/15, so that they can go in there and you can definitely get it in time so you can utilize all your dollars.
Okay.
Don't see any other hands, and I don't see anything in the chat. So we will move forward. Thanks, Toy. Anything else you wanted to add in that conversation we were having before we do that, Toy?
No, that was good. Thank you, guys.
You're welcome. All right, health and safety.
Good morning, everyone. Dee Nichols, Director of Family Support. We here at DFSS really want to emphasize staff wellness. So we're rolling out a couple of things with our mental health consultant, Melissa Moore with STG. And Melissa is our mental health consultant, but what we want to do is layer support on top of what you're already doing. So we're going to be offering office hours. Melissa's going to be there to answer any questions that staff have around challenging behaviors. If they want to strategize around different, ideas that they can do. You can see she wants to do real-time consultation. So I'm not going to read all these bullets. This is in our CSD update. We're very excited about rolling this out. We hope to have really good participation. So please spread the word. And you yourselves are also welcome to join Melissa. And you can see there that the first office hour will be offered April 3rd between 1 and 2. We set it up this way at that time so that classroom staff can also participate. And it's going to be offered after April 3rd on the second Friday of every month. Next slide. This is probably our third session with the Mental Health Power Hour. Melissa conducts these, and they've been going pretty good. The attendance could be a little higher, but the small group sharing is really good. This is our third session that will be coming up on March 22nd. Again, all of these are offered in CSD updates. And as you can see here, we're using the QR codes for your staff to register. Next slide. Before I go into back to sleep, I also want to mention that we want to be working with Melissa and I, your mental health consultants. So we have invited them on April 22nd to come to the Mental Health Services Advisory Committee. We have had so much interruption within our community areas with different things going on that we felt the need to involve our mental health consultants. They are the experts. And we were thinking, what if we brought them together and presented the idea of crisis support teams? We know you utilize your own mental health consultants, but this again would be an additional layer. So we're really looking forward to meeting and inviting your mental health consultants to come out and be with us on April 22nd. There'll be reminders and CSD updates. All right, our Back to Sleep campaign. As we go out and we monitor and we visit programs, one of the things that we're noticing is that infants really need to be placed on their backs every time you lay them down for nap. And so if you could just remind your infant teachers and those classrooms where there are family child care homes, we really want to send this message that to reduce SIDS and sudden unexpected infant death, we really need to be practicing safe sleep. And there's going to be much more around this. So Rachel discussed with me the other day that we want to do a media or PSA media campaign on this with our very own commissioner. She's excited about this. She wants to talk to folks about it. And we are also going to encourage Dr. Hilo, which is our medical consultant for DFSS, to work with us to develop this campaign to roll out toolkits. CDPH has tons of information on their website. And that's why I've listed out the various websites that we encourage you and your staff to visit to get additional resources and information. You can see them below. And again, they're in the CSD update as well. Any questions around this? All right, to the next speaker.
So before we move on, thank you, B, for that. Just want to remind everybody, can't stress the importance of it enough when we're talking about back to sleep. I also want to make sure that when we're talking about it in the documents and information that's here, is reminding your parents and your parent policy to be discussing this as well and trying to get this information out as broad as we possibly can. We note from the mayor's office and the information coming in that we've lost some very young babies sleeping in beds with their parents, and we understand some of the why behind that, but we also understand the risk behind it. And so that's why we're going to be doing this Safe Sleep Back to Sleep campaign, because we really need to get it back out there again, making sure that everybody understands it. And so there will be a campaign that's going on, but the initiating of that campaign is with all of you, that in your organizations, you're making sure that you're emphasizing the importance of children sleeping on their back, that if they're in beds, that there's no bumpers, there's no blankets, there's all those things that we know are risks to young infants, and their parents are not sleeping with their babies in their bed, because those are all very risky behaviors for very young babies who, will sleep, and they will sleep on if they get stuck somewhere and they're unable to turn their heads and breathe or reposition themselves. And so we have the responsibility for that, the adults in the life of those babies, to continue to do this work. Your staff that are in PI programs, your staff that are working with infants and toddlers are required to do trainings, and we will be making sure that we can document that as well, making sure that you have those certificates, that people are actually finishing these trainings. We have to make sure that we're doing our due diligence on our side as well. Any questions? no questions in the chat, no one unmuting, I'm going to go ahead and say, move on. Thank you.
Good morning, everyone. Sheree Johnson, Senior Director of Program Operations and Quality. Thank you all for joining us today. So just a few slides will be coming up here as reminders of things to keep on your radar. And especially during these times where we just have a lot going on, right? So this first slide here is a reminder to all of you that the Chicago Early Learning child care application for the 2026-2027 school year opens in 18 days. Don't look at the seconds aren't moving. I took this screenshot from Chicago Early Learning. The website is there in the middle of your screen, but it is 18 days away before the new application launches. A reminder that the current year application for 2025-2026 is there. So we would like for you guys to continue to enroll families for this current program year, but this application is for the upcoming or new program year. So if you have any questions, feel free to reach out, but the website is there that you can share with your families, you can share with your staff. There's a lot of great materials on the website in terms of FAQs and other materials to support with quality, high quality early learning and programming. Are there any questions related to that? If you have any questions, feel free to drop them in the chat or email me directly. We're going to go ahead and move on to the next slide. So again, reminder. So Saratho started the meeting by talking about, what's happening with ECBG, which is PFA-PI, closing out, meaning that some agencies will be transitioning from DFSS. Many of you will remain with DFSS. Those of you who are federally funded by DFSS will remain, but we also know that we're going through that recompete that Saratho mentioned. So no matter the funding, be it if it's federal or if it's on the state side, this is a reminder, and this is language that came straight from our CSD update, that staff working in our federal and state programs must have background checks on file. Our teams have been working with you guys. We've been reviewing your files. This is not new information, but we are encountering some instances where folks have been doing what they're supposed to do, which is having their staff, especially those who have been with you for 5 years, having them reprinted, having them rechecked for their backgrounds as required, which we applaud you. We thank you for that. We have others, while we're having this conversation, you're saying, oh, is it time yet? We shouldn't be the ones telling you that it's time, right? You should have an internal tickler system in place to help support with knowing when your staff are required to have background checks in place. So this is just a reminder to all of you. And I'm so glad that this meeting is being recorded so that you guys can know specifically that DFSS will be coming to further support you with background check monitoring. This is not new. We're not starting this as of today. This is an ongoing process, but you have an onus and responsibility within your agencies to ensure that you guys are doing your part to ensure that you are compliant with this mandate. Continuing the conversation regarding background checks, and yes, Iris, I see your question in the chat. We're going to go to it in one quick second. When we're talking about background check reminders for agencies, so this again is just something for you guys to take back to, your HR teams or anyone who's responsible for the background check process at your agencies. Having your HR managers engaged in this process. These are the folks that from the DFSS side, when we're talking about our HR or CM monitors, when we're talking about our data team, we're talking about Angel and budgets, we're talking about anyone who's inquiring about background checks. These are some key reminders that, again, we're sharing with you so that you guys can know what the expectations are. If you have questions related to the CPS background check in particular, because again, reminder, having that DCFS clearance alone is not sufficient. If they are funded by ECBG, PFA-PI, there is a requirement to have that CPS clearance as well. So if you have questions, we've included here on this slide the phone number to the CPS background check team. We also included the email address there. On our CPS background check packet, we have an internal contact here at DFSS, which is B. Nichols, our Director of Family Support Programs, Health and Safety. However, when it comes to specifics in terms of, well, did they fail? Did they pass? You know, if your employees have specific questions, they would have to reach out to the CPS background check team. That information is not privy to us here at DFSS. So again, another reminder for you guys. Are there any questions related to the background check or background check process or the expectations? And again, our team will be working with you. We will continue to work with you. We're just kicking this off and putting this back on your radar again. The slide is not new. I actually pulled it from a previous EDP meeting that we had. So just to remind you guys once again that this is a requirement for those of you funded by DFSS, be it if it's federal or by state dollars. Before we talk about attendance and enrollment, I see in the chat, Iris had a question regarding the recruitment materials. We are working with our vendor, Vera Creative. We're finalizing that list. They did reach out to us, letting us know that many of you, it looks about maybe 100 or so programs, did reach out to request the recruitment materials for new materials to be delivered to you. So we're finalizing that list, and the team at Vera Creative will be reaching out to you guys to, you know, initiate and talk through the aspects of delivery of those materials. When you filled out the form to request materials, you did indicate on the form where you'd like those materials to be delivered. So you will be notified in the very near future regarding the delivery of those materials. We've heard you guys, many of you are saying, you know, we're getting materials late. So we're trying to do our very best to ensure that you have your materials prior to the launch of the new application. So, you know, again, our team here at DFSS working with Vera Creative will be, you know, reaching out to you guys to ensure that you receive your materials within the next couple of weeks. Thank you for that question, Iris. Attendance and enrollment reminder. So you guys have kids and programs, right? Somebody give me a thumbs up. Please tell me you got kids in seats today. You do, right? Do we have a thumbs up from anybody? Oh, I see a thumb. Very good. Yes, we do. You have kids that are in attendance. You have children who are eating meals. You have staff who are providing quality services. All of that is grand, great, and wonderful. Yes, lots of thumbs. If we should, everybody should be thumbing up, right? What we need for you guys to continue to do, so this is a very, very important reminder. Tracking attendance and enrollment is not new. Okay, so this is a reminder for all of you guys. And Rosario, I see your question, oh, your hand. Give me one quick second. We know that you guys are providing these services daily, but what we're finding is that we are seeing some gaps in terms of timeliness of reporting. Okay, so this is a reminder that attendance is due weekly by Monday of every week by noon, you know, for the following week. Please do not pre-fill your sheet. So a couple of EDPD meetings ago, we had one of our project coordinators, Kim. She came to the front of the room at King Center and she reviewed this information. And I just, again, pulled her information because nothing has changed. Do not pre-fill these sheets. It will not count. So if you're filling out your sheet, you know, on Monday, I'm just going to fill it out today for the whole week. No, you cannot do that. It will not allow you to do it. It will not count for our attendance tracking. And again, we're going to show you a couple of examples on the next few slides, but every child needs to have a funding model assigned. So again, I'm going to show you an example. Making the next month's spreadsheet is your responsibility. You are the agency. You have a responsibility of creating your sheet. If you need help with this, reach out to the team so that we can assist you with this. Many of you may have received emails from either Kim here at DFSS or Bria or a member of our data team. I know many of our, you know, HR or SIA operations, support service monitors, support service coordinators who are monitors may have reached out to you, but it is crucial that you guys are completing your sheets in a timely manner. Without your information being reported to us, it may not count when we're doing our weekly, you know, analysis of attendance. We need to ensure that we have timely and consistent reporting from agencies. Okay. So the first hand that I saw up was Rosario. You want to go ahead and unmute? Oh, you had your question answered. Great. Okay. Thank you. Althea, you had a question?
Yes, so if I take the teachers take attendance daily, but I wait till the end of the week and gather all of the attendance and then I put it in on Friday. Is that okay?
Yes, as long as the attendance is entered by Monday, by 12 noon for the previous week, that's fine.
Okay, great. That's what I want to know. Thank
So
you.
what we've been finding, thank you for lifting that question. What we've been finding is that today, let's say today is Monday. We have some folks who are filling in for the entire week, forecasting that B will be here all week. How do you know that? You haven't even reached Friday and you're saying that B is already in attendance. We should not be doing that. So your method that you mentioned, Althea, in terms of filling it out on Friday, ensuring that, you're documenting what you know to be true because that time has already occurred. Or if we have some agency staff that are filling it in, because some agencies might say, okay, you have your manual attendance book physically there at the site, but then it's someone's internal responsibility by, 12 noon that day or by the end of the day that day to then track the attendance. That's fine as well, as long as it has happened and you're not forecasting or predicting that a child will be present when you don't know. Things happen where children are absent. So we don't want anyone pre-filling in the information. We want to make sure that it is accurate, and we want to make sure that it is, entered into the sheet timely so that when the team goes in to pull the information, we have the most up-to-date information. Are there any other questions related to attendance and enrollment before we show you guys a few of the examples that was previously shared? Okay, next slide for me. So these next few slides are just some, attendance and enrollment reminders, just showing you what it looks like. This information should not be new, but just showing you guys what each of your sheets will look like. You'll have the month in which that attendance sheet will, reflect. You'll have your agency name, the site name, and then the list of all children, the classroom information, et cetera, listed in the sheet. To the right, you're going to see, the dates in which for this current week. I know this says July, but you should have a sheet for this current week. We're in the week of March, week of the 19th, because today is the 19th. So you will have a sheet that starts for the 16th, which was Monday, all the way through Friday, in which you're going to list on the sheet, if the child was present or absent according to each day. There's a key at the very top, that green box that says you're going to enter 1 for present, 0 for absent, or X if that child was dropped. That's what we need for you guys to enter there. If you have any, gaps in this, if you don't put a 1, a 0, or X, it will not count. We need to ensure that children are counted accurately in your attendance. Next slide. Next slide. So here we're talking about the program model, right? So the funding stream, so it says I look specifically at the 4 federal streams. So I was the Kim. Kim, again, we're repeating the slide that she presented before. But, we are intentional in looking at the funding stream in which the child is enrolled. So ensuring that you're putting the correct funding stream for your children. Again, with an empty box or total at the bottom, which is automatically calculated for you all. If there's an empty box, it will not aggregate or calculate the, enrollment for you at the bottom of the screen. So we cannot have any gaps. If there's a gap, that will cause a gap in our data reporting. So again, just sharing this for you or with you guys so that you can take it back to those who are responsible for your attendance and enrollment. Next example. So here we even have a sheet for home-based programming. So I know many of you have home-based. If you do not have home-based, this doesn't apply to you. But there's a specific sheet for home-based programs. It looks a little different because we track attendance and enrollment for home-based a little bit differently than we do for center-based. So just ensuring that you're paying attention again to the week in question, because on their sheet there will be more than 1 week listed. Ensuring that you're filling out the correct date. Looking at the top of the page for any guidance. So here on this page is telling you some guidance that's in the yellow and the pink area to the upper left corner of the screen, ensuring that you're indicating in the middle there where it's saying, the type of program model, if it's home-based, if it's, for EHS home-based, expansion home-based, et cetera. Again, ensuring we have program models. If there are any gaps in any of this information, again, at the bottom of the sheet, the information will not aggregate. If it's not aggregating correctly, it makes it very difficult for our teams here internally to pull reporting and to further aggregate the numbers. So yes, if this was your agency, this is your one sheet. But keep in mind, here at DFSS, we fund many of you. So it makes it very difficult for us to go in and to pull this information from multiple sheets speaking for, and I know many of you, when we're talking about home base, many of you work with Freddie Carranza, and Freddie is like, you know how many sheets I have to go through, but he doesn't complain. He just reminds us, right? So we want to make sure that this information is accurate as possible to ensure that we are reflecting and reporting the most accurate information to those that fund us here at DFSS. Next slide.
Ms. Johnson, can I just interject one thing?
Sure, please.
So for your center base, I want to make sure that agencies are remembering, if your classroom is duly funded, you need to be able to do Head Start and PFA, or EHS, whatever it is, and PI. Don't just make sure that one funding is checked. If that classroom is dual funding, you have to capture both of it on the attendance sheet.
Thanks, Angel. So this particular slide here is a reminder for you all, because, we appreciate those of you who are very adamant, like, we know we did it. We met the deadline on Monday. I know for sure we did it on Monday by 12 noon. I just want to remind you that you do know that the system tells us when there are updates that are taking place in our sheets. There's a little button there that says catch up, and the catch up button tells us, when the sheet was modified. So what we do not want to happen is that our team is reaching out saying that attendance is missing. And then, you're welcome to argue or to be very steadfast that, you did hit the mark. But we just wanted to show you all that back-end reporting tells us when this information was updated. So we know for sure, we know immediately when agencies have not entered in their information, they have not created their new sheet for the next week or the next month. We know when this does not take place. So we just ask for your continued cooperation to ensure that we have what we need to accurately report attendance and enrollment. We also can see who has access to the sheet. So if access levels change, the person who you have responsible for attendance and enrollment may have resigned. They may not be at your agency anymore. You may not want them on this task any longer. Any updates of that nature, you need to immediately let us know so that we can continue to ensure that you have the access and that those folks can enter in the information timely. Next slide. That may have been the last one. And that's all that we had for attendance and enrollment. Are there any questions from anyone before we move on to the next slide? I don't see any questions, no hands raised. Who will we reach out to directly for questions? Related to attendance and enrollment, you can reach out to your HR or SIA support service coordinator on operations. You can reach out to me. You can reach out to Angel, the data team. Whomever you have access to. I mean, when we're talking about attendance and enrollment, depending on the nature of your question, if you have a question specifically related to the sheet, you're welcome to reach out to any member of the DFSS team, and we can support you with your question. It might be, depending on the nature of the question, we may have to redirect you like, oh, that's related to specifics related to da, 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 da. But anyone here within DFSS can support you with any questions that you have related to this. Thanks for your question, Tiffany. Okay, next slide. Angel, you're up.
Good morning, team. So this is just a friendly reminder. We all know that self-assessment is a requirement. This is to let you all know that agencies received a survey. We only have 3 agencies who actually completed the survey. So whomever is responsible for your self-assessment, please ask them to go through their email and complete the survey. We are having our first session April 1st at the King Center. The second session will be April 8th. At the King Center from 10 to 3, they will be content specific, and there's further information coming out about that in the CSD Cares, and also for those who signed up through your personal emails. Self-assessment for all agencies, because that's why she put it down there as urgent. It's due April 15th. And so please be mindful of that, because that's literally around the corner. That's tax time. Yes. Most of our stuff, because the grant ends early this year, everything ends early this year. And so we had to move some things up. Can we do next slide just so I can see if I actually put a next slide in there?
Nope.
Nope. Okay. Can you go back to the previous slide? My bad. Okay. So since I'm advocating for self-assessment as well, I also want to put on people's radar that the PIR is due earlier this year. And so the data team is actually going to be out and about trying to make sure for the deadlines that that component section is filled out. Our deadline is early this year. Therefore, your deadline for the PIR is early this year. Any questions about that? If you have a question about this, the self-assessment or the PIR, most of you all have been in contact with the data person that's over the PIR. If you have any questions about self-assessment, Berenice Vargas is the person, but if you send me an email, I can get you in contact with her if you don't have her email already. I don't actually.
Quick question.
Go ahead.
You said the surveys were already sent. Do you know specifically who it would have gone to? Like, would it have gone to the director of the program? Would it have gone to the RCA manager? Like, who would it have been sent to?
It was in a CSD update.
Oh, in the update. So not specifically emailed to anybody. Okay.
No, because at the time we didn't know specifically who, because we don't want to say it's that agency's data person, and that data person say, "Oh no, I'm just doing enrollment. I'm not doing data for everybody."
Okay. Thank you.
Mm-hmm. Now, okay, I'm glad you asked that question. So in my mind, that was a request. If you have not done it and you have a specific person that it needs to go to, feel free to email me so that I can make sure Vargas gets it so that she can, and I'm saying Vargas, it could be Mara, sorry, so that she can email that person. Any other questions?
Thanks, Angel.
Mhm.
And the team did drop a few links in the chat, you guys. So feel free to please check the chat and click on those links for registration for the self-assessment, the survey for the self-assessment, as well as Berenice's email has been added to the chat for you guys for reference. So the next, I believe, 4 slides are related to Claridine Inc. Ken, are you on? The team may not be on.
Yes,
And
I
that's
am
okay. Oh,
on.
you're there.
Hey,
Good.
yeah.
These next 4 slides are for you, sir. And I do apologize. This is all information that came directly from you. And this is really good information that I'd love for you to share with those in attendance today. Can you present these for us, please?
Sure. Okay. So, hey, good morning, everyone. Claridine Inc. As far as the first slide, with this slide, the big thing is that the health and safety module is up and live. A vast majority of your staff folks have taken the module. When I checked yesterday, it was over 2,100 folks have taken the module. The Spanish version of the module is also available. We have about 17 people who have completed the Spanish version of the module. You don't need to complete both, but we know that some folks were on the waiting list waiting for the Spanish version to come out. So that is out, and people who were on the waiting list have been enrolled. So one favor you can do for us is that if you take a look and you see you're getting an email about you're enrolled in the Spanish version, but you already completed the English version of the module, then please just go ahead and let us know that you want to be unenrolled from the Spanish version so we can go ahead and get you out of the count as far as looking like you're incomplete for that one. And if you get a duplicated email error message, the quickest way to get that resolved is to email us at pdmhealth.pdmhealthsafety, the email address right below down there. That is the easiest way to get that resolved if you have a staff person trying to register. One thing we are noticing occasionally is that people will say that I can't register, they get resolved, but then they're not taking action on it afterwards as far as getting into the module to complete it. So please encourage your staff that once they ask to get it resolved as far as the duplicate error message, to go ahead and get into the module and complete it, or let us know and we can let DFSS know in the event that someone's really having a tough time as far as trying to complete the module. Because we do see some folks cannot pass some of the knowledge checks, you know. Yeah. Any questions here on this? Yeah, and this is what the registration, what it looks like when you take a look at it. That's what it looks like. And then at the top, over on the top right-hand corner, that registration form can be translated into Spanish. So if you click that, it will translate the form into Spanish for folks who are trying to register for Spanish to make it easier for them to be able to navigate the registration module. Yep, so these numbers, like I said, have been updated. We're over at 2,100 now. And we're looking at roughly about, of folks registered now, roughly about 790 people are registered but are not completed yet. So like I said, please encourage your staff to complete the module. And completing the module means that you actually are able to print out a certificate of completion. We've seen a couple instances where folks get up to about 97%, but they don't do the survey at the end. So you want to actually complete to where you can print out a certificate, and they should be giving that to your HR department, and you should be having that in your files as well, because FSS will be checking on that. Any questions here?
We got one hand raised. Go ahead, Raven.
Okay.
Can you guys hear me? I'm sorry, my mute is acting funny.
Yep, we hear you.
Good morning, everyone. I just want to add to what Kim was saying in regards to the certificates being printed. So your HRRC SSCs will be checking for these as part of your HR files. So as your staff get them, please be sure to print them and add them to their HR files. If they are not added, once the team comes out, they will mark it as non-compliant. That's all I had. Thank you.
And last thing is the fiscal community of practice is underway. We have our fiscal community of practice usually on the third Friday of the month. I want to confirm with FSS, given what we just heard from CPS about maybe pushing that back by a week so we can come up with a little bit of a better discussion around some of the items that were listed for monitoring. So we might be pushing that by a week. Also, we have our PDM trainings that are listed on our ecenews.claridime.com website. So you can go to that page and see what the upcoming trainings that we have for PDM, and we're always updating that with new and additional trainings. So check that maybe weekly just to take a look real quick to see what's coming up, and encourage you and your staff to register for those trainings, okay? And we are working with FSS on the collaborative governance module. I know one person has reached out to us asking about getting access to it. Just hold tight, and it will be launched, and we'll let you know. Anybody who's emailed us about trying to get access to it, once it is launched, we'll let you know, and we'll let you know the process about how you'll be able to register and get enrolled in that. Yeah. And the last bullet on this slide, if we can go back just one time, we know that there have been some changes based on folks moving from ECBG agencies, moving over to other grant recipients. So that sort of changed those folks who were in that no-cost option. So if you're moving and you want to talk about, I still would say we should most likely have a discussion about a couple of artifacts that we'd like to just transition over to you anyway, if we can find a way to do that, even though you are moving to another grant recipient, because we've sort of invested in those things already. Yeah. Any questions here? And as far as registration for the health and safety module, yes, registration is still open for everyone. And there's a list of FAQs that are on the screen. And one of the biggest things there is that if you took the module back in 2025, as far as up till November of 2025, if you completed it any time before then yes, you do need to take the latest version of the module. And this is how you would register for that. And as I said, that the Spanish version is now available for you as well. Yeah. No questions? Then I'm gonna head back on mute. Okay.
Thank you, Ken.
All right.
Good morning, everyone. My name is Sharon Davis. I am Director of Accounting here at DFSS, and I will go over the expenditures for the FY25 and FY26 programs for both federal and state. And so I will start out with the FY25 federal programs that are in closeout process at this point. We had anticipated that these expenditure levels would have been at 100%. So as of November 30th, when these programs close, Head Start program closed at 92% expended. Early Head Start closed at 89% expended. CCP closed at 72% expended, and the expansion program closed at 90%. So for the new programs that just started in December, for the federal programs, we anticipated that these expenditure levels would be around 25 to 43% expended. The reason that there is a range, as mentioned previously, the Head Start, Early Head Start, and CCP programs are funded through June only this year, and the expansion program will be funded through November. And so for the Head Start, Early Head Start, and CCP programs, those should be at 43% expended at this time under normal circumstances, and the expansion program would be at 25% expended at this time. However, we have had a slow start to this year due to funding being rolled out a little later this year, and awards being adjusted. So please be patient with us, and we do appreciate everyone's patience with us getting your budgets processed. So the numbers are actually low because we're actually waiting for the budgets that are processed to be approved. So once these budgets are approved and the expenditures can start, then these numbers would improve. So for the Head Start program, currently right now, that funding is at $14,828,030 for the 7 months. And currently we do have expenditures just based on normal, constantly funding for payroll and fringes that are constantly running from this grant. And so right now that Head Start program is 3% expended just based on funding expenses for that program. And the Early Head Start program, which is funded for $19,612,258, is currently expended at $862,748.27. Same for that one. That one is currently expended at 4%. The CCP program, which is currently funded for $11,178,139, is only expended for $341,031.54 at 3% expense, just based on the payrolls running. Expansion, same for that one. The expansion program, which is running through November, is currently funded for $4,221,823, and it is currently expended at $138,700 at 3% expense for that as well. For the state programs, ECBG and CCAP, the funding levels should be at 67% expended at this time. And so for the ECBG program, which is funded at 101, 124, 439, is currently expended at 47,208, 462 and 95 cents at 47% expended. CCAP is currently funded at 10,816 and expended at 3,891, 774, 76 for 36% expended. And a few notes here for the Head Start federal programs that ended in November. Those are going through closeouts. All of the vouchers should have been submitted. If you're currently still getting emails from our controller's office regarding any deletions or any rejections, please reach out to my team as soon as possible if you need to rectify any vouchers that are in arrears that were submitted incorrectly. And also, if you have any remaining in-kind reports, we're still accepting those in the Sell in-kind email as well. Please give us a heads up if you do. And so for the new programs that started in December, the base programs, of course, have been shortened for the Head Start, Early Head Start, and CCP program. And we will give more information about the remaining funding starting July 1st. We will give more details about that. The initial budgets are in review, and those that have not been, so we have gotten some approved, and we will be reaching out to you hopefully by tomorrow to let you know that your budgets are approved. Please check iSupplier to make sure that your budgets are there, and we will continue to notify you as we get those approved. We anticipate having the remaining budgets approved by the end of March. And for this year, as you know, all federal funding is required to have a 33% non-federal match. And if there are any questions regarding in-kind, how to report your in-kind, how to submit your reports, please reach out to us at the Sell in-kind email as well. And a few more notes regarding our state programs. Our child care billing should be billed through February 28th. If there are any issues, please verify all attendance and eligibility records. Please resolve any unresolved issues. If there are any unresolved billing issues, please notify us. And our emails and contact information is there. And for the PI-PFA programs, the budget revision deadline is going to be May 15th. I apologize. The deadline for budget revisions is May 15th, which is typically 45 days before the end of the budget period. And so please get your budget revisions in to us. Invoicing through February 28th should have been submitted at this time. And your final invoicing deadline for 2026 vouchers is going to be July 24th, 2026. If there are any 2025 vouchers that are still outstanding, please reach out to us and give us a heads up. If there are any budget revisions related to 2025 expenditures, please give us a heads up and let us know. Typically, we close out our 2025 expenses around the end of January, just so that the fiscal year can be reconciled. iSupplier updates. The next iSupplier monthly training will be on April 14th, and contact information and link is below. Insurance updates. Please make sure that your insurance is up to date. Expired insurance will hold up your contracts, will delay your invoicing and payments. Please make sure that your contact information is up to date in both iSupplier and on your customer profile app in the iSupplier system. Please make sure if you change any contacts, please reach out to DFSS as soon as possible so that we can update our internal records. And if there are any changes to your contacts, please let us know, as the Comptroller's Office is relying on your information to be current and up to date. If they're trying to reach out to you, they're going by the information that you have listed in iSupplier. Training materials are in the link below for the City of Chicago's contracting iSupplier website. Finance contacts are listed here. Head Start and Early Head Start is Teresa Lopez. CCP Expansion Incorporated is Laverne Coleman. Child Care is Selena Ruan. PIPFA is Cassandra Molina. Are there any questions?
There's one in the chat from Pamela. Do the budget approvals include vendors?
Yes. And thank you, Sheree. So yes, if you have budgeted for agencies within your program and you have partners, please let us know, because that will affect what you currently have reflected in your budget. Please reach out and let us know any changes that you would need to make within your budget. So yes.
Master's degree verification. Oh,
I believe we had a hand raised. She lowered it, so you may have answered it. Sarah, do you still have a question?
Okay.
Oh, it's in the chat.
Yeah, I do. Sorry, I put it in the chat, but Sharon, is there a timeline for when we can expect our budgets to be approved and entered back in iSupplier so we can start vouchering?
Yes, for the federal programs, we anticipate your budget should be approved by March 31st. Now, those are on a case-by-case basis, depending on the review that the Comptrollers is making. And so if you have individual questions regarding your budget, please send us an email just so that we can check and verify your budget specifically. But on a general basis, we're anticipating by March 31st. All of the budgets that we have processed so far, we are working with the Comptroller's Office and gave them a timeline that we would like for them to work with. So
those were all, okay.
She asked us, and she said that. So
I'm sorry, does someone else have a question?
Oh, is she sending them out now?
Is anyone asking a question? If not, if you can please mute. Go ahead, Sharon.
Okay. Thank you. So yes, we will reach out and give everyone an update by April 1st to give the Comptroller's Office enough time to be able to approve the budgets that we do have in process currently, and continue to check iSupplier just to make sure that your budget is listed there. So if there are any specific questions, please reach out to us and we will respond accordingly. Thank you, everyone.
Thanks, Sharon. Are there any additional questions, or from my team, is there anyone who has anything else that we need to add today?
The only thing that I would like to add is agencies, please be on the lookout. B and Sheree talked about background checks earlier. In your emails come next week from Sheree's email box, you will be getting some information and a deadline, which will be for next Friday is just updating some information that you previously gave us for your background checks. I also would like to mention that if I have sent you an email requesting a meeting with you, Soreto, and myself, and so when I say you, I mean the agency, sorry, the agency, Soreto, and myself, please respond to that email as we have budget questions and concerns, because we're trying to make sure that your budget gets approved in a timely fashion. And then for my ECBG agencies who are underspent, don't think I've forgotten about you. I'm going to start those team meetings up again so we can talk about your expenditures.
Thanks, Angel. I don't see any additional ones in the chat that hasn't been responded to. I don't see any hands up. So I do, as always, if I'm going to be out of the office for any amount of time, I always want to let you know. Currently, I'm going to be out of the office from the 26th through the 31st. I'm going to take a couple of days vacation. But the team, Sheree, Angel, and all the rest will be available to you if there's any needs. They will have access to me on an emergency basis, which I don't anticipate any over those days. I just anticipate sun and rest because that's what we're going to have. Thanks everybody. I see the hearts and the hands. Believe me, I need it, y'all. So, if there's anything, I'm trying to get everything off of my plate, any questions answered. That's why, the team trying to schedule meetings and other things in advance so that I'm not leaving things undone for the team. But know that you've got a team that's here while I'm gone for a few days. And if anything comes up, if there's anything urgent, they've got access to Commissioner Green and other leadership members here. Thank you. Thank you, Beverly. If there's anything that comes up, don't hesitate. Don't wait on me to get back. Please keep things moving. I did see one hand that did go up and came back down. Was there a question or a concern from anyone? All right. At this point, having no one else have any other agenda items, I don't see any questions in the chat. I don't see any hands raised. I want to thank you as always for everything that you do every day. This work has not been easy. This year has not been easy. Things shift constantly and we're trying to stay ahead of it. If there's anything that we're missing on our side, meaning DFSS, please don't hesitate to let us know so that we can keep you informed. We are doing everything that we can to stay on top of everything. We've got the policy team and others working to stay on top of anything federal so that we can keep up with it, so that we can keep you on task and on target as well as ourselves. And so I thank you. I thank you. I thank you for everything that you do every day for every child, family, yourself, and your staff. And I thank you for all of the comments. Yes, I do need the break and I am going to enjoy. I am going to get on a plane this time. I normally just get in a car, but this time I'm boarding a plane with everything going on with TSA, right? But I am going to board a plane and go seeking sun and ocean because that's what I miss and that's what I need right now. So I'll be gone for a few days, but you will all still be in my heart. I'll be thinking about you for about a half a minute or so while I'm gone, but definitely we'll be back to see you soon on the on the 1st of April. So everybody take care. Love you. Please take care of yourselves and take care of those that you love and who love you. Take care, everyone. Have a great day. Thank you,
Thank you.
everyone. Yes, it is needed. Thank you,
Enjoy.
thank you, thank you. I will. Thank you, everyone.